Adaptability, to what extent tools can be adapted to local situation? Absolutely. This is key. We really want to emphasize that this tool is just kind of like an example that you can take and adapt it as you need to, as long as you keep these core information collection that we've agreed on. These tools in a way in which will respond most appropriately to your individual specific context. May likely require your identifying partners, though, to help, and identifying even teams that you can provide training to, if that's possible, who can go out and do more of this data collection, or at least compiling existing data.
That's why, if you remember, initially we thought of only bringing 3 or 2 colleagues to this workshop, to this consultation, and then we proposed that we expand it and include another person, at least 4. So that then when you go back as a team, then you could also consider the support of the local organization in that specific site. So again, because we know that the resources, human resources, are not enough, and in fact, in some settings you only have few, but also in some settings you have more than 3, 4 colleagues. So please think of not just within the for example, health department, but also the civil society or the local.
A potential, just a possible model for how to eventually take these training.
It will be useful also probably to encourage countries to use their existing planning process or existing, for example, in Vietnam, there is a plan to develop master plan, and as part of that there would be these provincial level master plan development, situation analysis and planning exercise. So rather than narrating that okay, these are the steps to be followed and giving guidance on what to do, probably countries can, in the end what are we wanting? We are wanting a situation analysis in the end. So countries should have probably a flexibility, at least those countries who have something ongoing which can fit in with this, probably not 100%, but with a great degree of comfort and meeting all the end needs that you are looking at. Probably, that would serve both purposes. First, not have too much of taxing on the resources, and then aligning with country-owned existing program line. So that would, in the end, probably in July or whenever you meet, probably few countries can also present how they have, using the existing planning process, using the existing programming in country, they have been able to meet the things or the benchmarks in this particular project.
So all we're doing is we're adding in, for each of these 6 assessment areas, we're adding in, and for each of the indicators, adding in some core questions. And these are fairly strategic level questions, but they can be looked upon as a potential core group of questions that we may want to, program directors in an organization, you can ask, please describe how your organization or city area department is involved in the HIV response, and particularly among key affected populations, because this is the group. Continuing down the list, number 3, we have, for instance, for each of these 6 sections, these 6 areas, we have about 6 or 7 questions. Okay, so how and to what extent has the policy and legal environment contributed to or hindered reduction of AIDS-related TB deaths? And how and to what extent has policy and legal environment contributed to or reduced AIDS discrimination and or gender abuse? What are the main constraints and challenges regarding the policy and legal environment? What action has been taken? So again, sometimes some of the framework targets talk about strategies. But there may be strategies in place, but I think, as Marlon mentioned, there may not always be action. Again, we have a set of about 7 questions. Service delivery, and this is all in regard to new infections, okay? So again, what institutions are providing services for HIV and related services, sexual and reproductive health, TB, etc. And you can probe to find out which facilities. So these are all Again, questions that we want to get feedback on from you today. Get a sense if these are reasonable. What are your views on the appropriateness and effectiveness of city area services delivery and response in relation to, say, a national strategic plan, or the targets from getting to zero, or the high-level meeting targets? For example, is money being spent on the right things? Could programming be more efficient and effective? Any examples of best practices? How and to what extent have the coverage, reach, and quality of services contributed to or hindered reducing sexual transmission of HIV, especially in the key affected populations? How and to what extent have the coverage, reach, and quality of services contributed to or hindered the reduction of HIV/AIDS related to TB deaths, the reduction of AIDS-related discrimination, the reduction of gender abuse violence? What does the city or area programming need to do in the next 3 to 5 years to significantly impact the epidemic? In terms of policy, in terms of strategy, in terms of finance, programming, the way the system is organized, the bureaucracy, integration with health systems, enabling environment, political incentives, etc. Who are the ones who are taking the lead in innovation? The real, how do you find where did the transgender crowd hang out? You know, how do you reach them? Who's falling through the cracks? And what are the innovative ways to reach these forgotten or neglected populations? Or maybe it's prisoners. You know, who's are these issues? Okay, so identifying the gaps again. Okay, sustainability plan. How are resources allocated in relation to the epidemic and to achieving the high-level meeting targets? Is it allocated based on percent of budget for various parts of the program? A percentage goes to treatment, a percentage goes to prevention? Or is it on, in line with the epidemic projections? Get an idea of how decisions are made in terms of where the money is spent. Number 8, what does your city area response need to do to significantly impact the epidemic in the next 3 to 5 years? So again, we're looking down the track. And this is, again, these questions of sustainability, what needs to be done and what is possible to do, what is potential to do. What should development partners be doing to support the city area response in the medium term? How is the city strengthening an effective enabling environment, especially for these key affected populations? What more needs to be done and by whom? How are the external funders supporting this? Any recommendations specifically for potential for scaling up successful interventions?
Back to this framework where we discussed earlier in the morning the areas to assess and the targets that we would like to look at. So here we have 7 targets, and then here we have areas to assess. The list of questions that Jim has developed are a list of questions being developed to help us identify appropriate questions for each of the areas. Policy and legal environment, the key questions that we would like to look are 1, 2, 3, 4, 5. So those are the key questions that Jim has presented. Just to bring us back to the picture of this framework. Yeah? So everything will go back to this framework. If you think that the questions being presented not relevant, we can take out, right? If you think that you have opinion, there are other questions that are more appropriate to put in. So this is how we are going to do the discussion. The questions that are being presented is not set in stone, right? Is it set in stone?
Nothing is.
It's not set in
The big word draft is written across everything here. It's all in process and very much open to revision.
The key question is, what do we want to know about this target?
Quantitative data. Yeah, that 2 points that is still hanging there. So we consider again. So I still don't have answer for that, but I will open for the question first before we break out for the group. I start from Dr. Shito said, Cintana, let me ask first. I go for Dr. Shito first. And maybe Dr. Lee can soon over there, the second question.
NGO that works in your city, for example, and ask them what they're doing, and then in terms of these 6 areas, policy and services delivery, if that's what they do, coordination, multi-sector work, and then these questions can be revised based on who you're talking to. There is a set of ideas of how to revise them basing on in the back. There's these question guides looking at government respondents, for example, versus civil. That would be what we discussed this morning. I think and come to an agreement that that would be our key areas of inquiry.
Some of the questions proposed in this sample question to us, no? So, are we to put really been collected and we just answer them? Some
Yes.
we need to take another effort to collect
Right.
the answer.
Yeah.
Just to clarify, again, the last column is just the menu that Dr. Jim proposed to us. The first column, second column, third and fourth, we agree before we go for lunch. But the last column is just the option recommendation for us to go through this exercise. When we go home and then we may need to adopt this question or we may need to adjust, as Dr. Lee Pen-soon already mentioned. Yeah? Okay, that's the agreement now. So, further comments? Don't say that Cintana harassment, no, na. Dr. Shari, raise the hand. Dr. Shari, please. Two hands. Dr. Shari, please.
I can see the math question. And then after that, we must also have an optional question. And we also, if the set of question is not there, we must add in some question, we call it bonus question. Can we have these 3 kinds of questions? Then we can make at least a comparison. Minimum of math question, optional question, and bonus question. Yeah. Okay?
So our menu has been clustered into the 3 clusters. One is I think the point of Dr. Shito is also, what would be the math question, the minimum question that we like to ask, yeah? Second question, good point, he said optional, it means take it or not, it's up to you. Third one, the bonus question, so my point is that what is the difference about optional and bonus?
That one is not in the list, but you add in additional question.
Okay. I stop here for a while. 3 clusters. Dr. Teresa would like to comment on that. 3 clusters or another 4 clusters?
We send the paper question to the other section to get information. After that, we are discussion workshop discussion become or the discussion about the policy and legal environment. Because in Vietnam now the policy and the international matter is a good policy.
We are putting now is National AIDS Registry. We notify HIV, we notify AIDS, and we notify death. That's why we have roughly an actual numbers in our system. And at the same time also we do some EDP estimation projection using spectral model, and in 2012 we supposed to have roughly around 81,000 people on HIV. Question is compatible. The difference only 2,000. And we also calculate regarding age group, male, female, and risk factor. So that's why we managed to get who are the people on at least. And we also did the last estimation using the model 2011. And you can see that the IDUs are almost plateauing. female sex workers are plenty, MSM is increasing, higher sex workers is plateauing. So our concern now is most probably looking at the MSM group. And we have our vision, and we are aiming by 2015, the new infection rate will be 11 to 100,000 population. It was based on the year 2000. In year 2000, our new infection rate was 21.7. So we have our vision before in year 2000 to reduce the number of HIV by 2015. That's why to me that getting zero is almost...
Question, very good question. If we thought that it's not applicable, or we given comment like the possible, the lesser degree possible, but it will not be 100% applicable. But I think one question with regard to the policy legal environment. This is not, I think, impossible, something like that. This question cannot be asked to the respondent, something like that. So in this way, we try to give our comments. So most of the question, as I mentioned, we fully agree, and the red one, this one, the reduction of AIDS-related and TB deaths. This kind of question is difficult for us, I think, not applicable for the rest.
City Unit I in Bali have 2 districts that will be held. This assessment have a very different bureaucracy and government. So this will be making the credibility of the informant, what's best, the information that we'll get, including impact of the enhancement of the effective program. For more information, we in Bali and also in West Jakarta is already doing workshop about this in Bali around July 2012. We already invite some of our stakeholders from the Provincial AIDS Commission, Provincial Health Office, and also AIDS Commission and Provincial Health Office in the district and city. Also at the prison level, we already invite them, and we already give them homework about this, some of this assessment and tool that I see is a little bit different from there, but most of the question is already stated in the this assessment.
After checking the applicability, we also checking whether it's feasible to collect information. So, and we also checking the link of that question to the so-called target of the getting to zero target, which is in the second row, second column of the matrix. Like the first question, example question is, please describe how your organization or city area department is involved in the HIV response, especially for among key affected populations such as MSM, female sex worker, IDU, and their partner. So this question is applicable to our country, right? And it will also link to